This is Aravind. So we have submitted our first round presentation for Evathon 1, and our domain is healthcare, and our domain code is Evathon PS001. So these are my teammates, Giridhar and HEMKUMAR. So initially we have approached this problem statement, which is the hidden factors behind the COVID-19 spread and how to calculate this exact number of these cases. So the given statement, initially we have divided this given statement into three problems. The first one is those people, those who are really in need of help in this pandemic situation, and second one is those people that were unaware of the situation while getting vaccination in hospital. The third one is low immunization people, I mean LIP. So low immunization people are unaware of their COVID-19 situation, and they are at the high risk of being caught COVID-19, and maybe the rate will increase. So we have postulated three problems, and we have finally came out an idea of creating an app to solve these problems. So next, Kumar will postulate these solutions.
As Aravind said before, we consider the problems as the hidden factors which ruins many of the people's life. So Aravind mentioned that three problems. First one is the people who are in need. Second one is the people who are unaware of their getting vaccination. Third one is the LIP, low immunization people. The solution for the first one is actually bridging the humanitarian service and the people who are in need via this app. We actually going to create we're actually going to implement an option which is known as humanitarian services, which is going to connect the humanitarian service people and the people who are in need. Even the poor people can have their mobile phone or having their mobile phone, so they can easily access the humanitarian services. So the people in need can actually get the help they want via this. The second one is the people who are going to get vaccinated. They actually unaware that they are also the victim of the COVID. So they can monitor and actually see how many people are there in the vaccination center from their home. Yeah, this app. First of all, they can also they can also book their slot for vaccination via this app. The third one is the people of the LIP, the low immunization people. The low immunization people are really unaware that they are the important victim for this COVID-19. COVID-19 is looking for the low immune people, just like the kidnappers looking for the children. They totally will doing everything for them. Apart from the low immune people, there are other people like people with diabetes, the heart disease. They are also the victim. So this app helps the low immune people to get in attached with the hospital where they actually check their body, because the hospital will keep of the patient's record, and this process will become very easy. The hospital can give them a certain alarm or alert for this patient to get actual safety measure. They can easily look through the patient history and alert them they should visit hospital regularly to check their health condition. And this app also alerts them when they are in crowded and borrowed areas. On the whole, these three solutions will make this app into a one. The humanitarian service and volunteer, however, they are quite a large in amount. In some countries, are not able to reach the people who are in absolute needs, and this helps them to connect them within this. This will be largely effective in populated countries like India, and some other countries like Australia, or something like that. So this app will certainly help them to get connected. That's all. Like I said, now Gridhar will continue how this app will be created and what are the tech and developers are going to use in this app. Gridhar.
The problems which are mentioned by HEMKUMAR can be controlled by creating the health app. The app can be designed by using the protocols like the front end and the back end can be designed by using Python and NGINX, and the frameworks which can be processed using Kafka. The data which can be collected and analyzed and processed by MySQL. The data can be stored and shared in cloud using Amazon EC2. We including a search engine with the help of Elasticsearch, the application deployment using Ansible, the monitoring infrastructures and the log analytics can be done by Grafana. Web assist and contents can be designed by Apache. Now Aravind will conclude this.
Yeah, so like Giridhar and Hemkumar said, we have put together this all these ideas and problems into a single app that will help those people those who are in need. So for for us people in India, which with a huge population, the service of humanitarian and the social workers doesn't reach the people those who are really in need in time. So with our app, with our idea, the service and the the service will reach those people in those who are in need in time. And we didn't mean to revolutionize this earth with our app, but we just want to help the humanity at its need. Thank you.